We've arrived at our field trip to the doctor's office, so let's review our expectations. When you exit the bus, you're going to walk over to those bushes and form a line. We want to stay as far away from this road as possible. And also, you're going to, when you're in the office, you're going to use your listening ears. If you have a question, you will raise your hand and an adult will answer the question. And most important, keep your hands to yourselves. You're going to see lots of interesting and curious items, but those items do not belong to us. And again, let's remember our manners, that we are guests in this doctor's office, and we want them to think excellent things about students from Woodlawn. So let's go and greet Mr. Thompson. We're visiting a medical surgical practice to explore maxillofacial disorders that affect nutritional intake. And here is the entrance. We're looking at how nutrition can be affected if there are jaw problems. Thank you, Mr. Thompson, for having us here today.
You're welcome.
He is a maxillofacial physician assistant at the office. He works with a maxillofacial surgeon, and they help people with facial disorders. So let's go ahead and step into the office. Thank you. And Mr. Thompson will show us back to the laboratory.
We're going to walk into our laboratory first.
Okay. Can you first tell us, we're hearing this word maxillofacial. What does that mean?
That has to do with your facial bones.
Okay. And what kinds of things do patients come to see you about?
Well, their teeth don't line up right, so they're not able to chew their food correctly.
And how does that happen? Why is somebody that way?
Well, they can either be born that way, or they can have an accident that makes their bones deformed, so they can't bite correctly anymore.
So it could be, they can either be born that way, or they could have a car accident, or even a simple accident like riding your bicycle and forgetting to wear your helmet, where you might hit that hard ground and injure your face.
And that happens.
So do you have any models you can show us of what a normal facial bones look like?
We do. This part is where when we take our impressions of people's jaws, we can put them together and we know how they're supposed to fit. So that would be like a normal bite, and this would be a bite that's not fitting correctly. So this is where we do the technical work in our office. Let's move on to our examination room and we can show you some more.
Okay. And then this here would be like a chair where one of your patients would sit and you would be able to examine their...
That's the laboratory chair.
Okay.
Now this is our exam room chair, and it's a pretty nice chair. It moves all around for us.
Oh, wow. Okay. So you're able to maybe look in the mouth a little bit easier when they're laying down.
Right up here, look in the mouth. We have instruments that help us look in the mouth.
Okay.
And then when we're done, we just simply sit them back up, and the chair goes all by itself back up.
All right. And I noticed you have some skulls over here.
We do. This is my friend. Hello. So, when they have disorders, their jaw may be... Well, let's use this friend here.
Do you have a normal jaw that you could show us?
This is a normal jaw.
So that's what my jaws and all of the rest of us looks like.
So if you look at this, you see where the teeth meet in front, they meet on the sides. So,
okay.
And then it opens and closes.
Okay.
Now, when we look at this little fella, he got kind of cracked up a little bit. So we can see when we look at him that his teeth don't line up in front no more.
Right, they're kind of to the side.
Well, and the lower jaw is further back, see?
Oh, okay. Not straight up and down.
No. So now what we'll do is we'll do surgery. We'll move him straight where his teeth are up and down now.
Okay. But when he came to your office and how did that help? How did that affect his health when his teeth were not lining up?
Well, when your teeth don't line up in front, then you can no longer use your teeth to bite into food. Let's use our other model. It's a little bit easier to look at. So, if his jaw is dislocated, say it's like that, when he goes to chew, he's only hitting on these back teeth chewing. See, his front teeth aren't chewing at all.
Right.
Well, you can only chew your food up about 70% of what you would normally chew it up if all your teeth fit and hit together when you chew like that.
Okay, and we had an earlier lesson on digestion with the stomach. So if you're not chewing your food, that can give you stomach problems and digestion problems.
It can make it much harder for you to digest your food because the food's not broken up into little pieces when you chew like this.
Exactly. That's what we spoke about in our lesson. And then I heard sometimes the jaws won't open all the way. Maybe somebody's born where their jaw only opens a little bit. And does that affect the health of somebody?
It does. It causes pain. All these muscles are wanting to try to open the jaw, and the jaw won't open. And this is the little joint that causes the jaw to open. We'll kind of distract it apart a little bit. And you see there's a little rubber piece.
Yes, we
this
see
is
that.
falling out. And oftentimes that little rubber piece can get beat up. So we'll have to go back in, just like this one's falling out, and we'll have to put it back into where it's supposed to go.
Okay, and then so in surgery, you guys are able to, you and the surgeon are able to fix disorders like this.
We are. So these represent the muscles. So when your jaw opens, they stretch. Well, if this part won't move, your muscles try to pull, and they start to hurt. So we'll go in here, we'll make this so that it's all nice and round, so that this ball part rotates in the socket part. The skull base actually forms the socket, and the lower jaw is called the mandible, and that's the ball part. So you want that ball to fit nicely into that socket just like that. You want it to rotate just like that. Okay. So that's much easier.
Oh, okay. And that way they're able to eat all kinds of foods so that they can stay healthy and strong.
That's correct. And they can break their food up into smaller pieces too. Because when you can move your jaw freer, then you're not going to get as tired when you move your jaw, and you're going to chew your food up better. Okay.
Well, very good. Thank you, Mr. Thompson, for welcoming our whole class here today and showing how conditions of the jaw can affect the health of our body. Thank you again, Mr. Thompson, for having us.
You're welcome.